Hi, Gwazi, Gaitawa Haupa, Dushiname Adzaya, Yakukuchinashanu. Hello, my name is Jennifer Nanez, and I'm from the Pueblo of Acoma in New Mexico, and currently work with the University of New Mexico in the Division of Community Behavioral Health. We are part of the Department of Psychiatry and Behavioral Sciences. Today, we'll be talking about trauma, and more specifically, historical trauma, a concept developed by Dr. Maria Yellowhorse Braveheart to describe the impact of histories of trauma the American Indian and Alaska Native population have endured since colonization. So first, let's define trauma. Trauma is an event or series of events that can happen to a person that is physically or emotionally harmful and that can have lasting impacts on our physical, emotional, social, cognitive, and even spiritual functioning, really across our whole being. Populations can also experience trauma through events and policies that are directed to that population that cause harm. For the indigenous population here, now known as the American Indian and Alaska Native population, colonization was a precipitating event that set off over 500 years of trauma and subjugation. Colonizing entities and their governments sought to eradicate the indigenous population through war, removal, and systems of enslavement such as the encomienda system as means of usurping resources and land. So under governmental rule, there were specific policies like removal that stripped indigenous populations from their homelands and corralled them onto territories and reservations away from their environments, their cultural practices, and even their food systems. The establishment of residential boarding schools in 1879 across the nation was another policy that removed American Indian and Alaska Native children, some as young as 4, from their families, their parents, extended families, culture, traditions, and tribal communities. To illustrate how far-reaching this policy was, by 1926, nearly 83% of all American Indian and Alaska Native children were being removed and placed in residential school systems. This long-ranging policy also caused mass loss of traditional tribal languages, disconnection from cultural traditions, and from their communities. Over the course of time, these policies and events served to create trauma across a population. Dr. Maria Yellowhorse Braveheart calls this intersection of history, events, and trauma historical trauma. And historical trauma is defined as the cumulative emotional and psychological wounding over the lifespan and across generations emanating from mass group trauma. She and Dr. Josephine Chase continue to work across their careers to give us the language and frameworks to understand this trauma and trauma history and trauma present. So individuals who experience trauma can develop trauma responses, hypervigilance, anxiety, depression, PTSD, and PTSD-like symptoms. They can also develop coping skills, both positive and negative, to deal with that trauma. Populations can also develop trauma response as well, and that trauma response can influence the way individuals raise their children and then their grandchildren. Trauma can also initiate epigenetic change, turning on and off genetic markers that can trigger illness and disease burden. Then they can get passed down and predispose future generations. We must also examine these histories of trauma and present-day trauma in the context of inequity and historical oppression. These inequities in access and resource can also exacerbate trauma and trauma response and their impact. Examples of these inequities can include inequitable access to funding for service programs that are created for our population, lack of access to quality educational systems, lack of access to adequate housing, lack of access to economic stability, and even environments that may be contaminated, and when we're experiencing social injustice. So we see these impacts in our indigenous population. It has an impact on our bodies as well. For example, higher rates of disease burden, like diabetes. 1 in every 3 American Indians and Alaska Natives develop diabetes across our lifespan, hypertension, cancer, high rates of depression, anxiety, and even PTSD or PTSD-like symptoms. And suicide accounts for the second highest cause of death for our population for American Indian and Alaska Natives aged 10 to 34. We also see high rates of substance abuse. Yet, despite all of these traumas, both historical and present, in all of these challenges we face from historical trauma, trauma responses, inequitable access, oppression, and disease burden, we are still here and still resilient. And right now, our tribal communities are working to heal from historical trauma through reconnection to cultural traditions, beliefs, practices, ceremonies, and language revitalization, and in creating mental health and substance abuse treatment programs that are based in our cultures and Indigenous worldview. An example of youth programming like the National Indian Youth Leadership Program's Project Venture is a wonderful example of prevention and treatment approaches based in experiential learning and Indigenous worldview. Evidence-based practice approaches are helpful, but many are not normed on our population. So adaptation and localization are important to create treatment and service approaches that fit our communities. And these adaptations must be much more than surface level, language, imagery, references, but truly coming from our practices and beliefs. It is also important to remember that there are over 574 federally recognized tribes, bands, pueblos, nations, and Alaska Native villages, and each are unique. So we must be cautious around adaptation that becomes pan-Indian. For our people, when facing these challenges, reach out. More and more programs are being developed in our communities to help address this trauma and trauma response. Tribal behavioral health programs, social services, urban Indian programs, and broader service programs in our communities, and even the Indian Health Service, Bureau of Indian Affairs, and Bureau of Indian Education are working to help support healing from historical trauma and trauma histories. We can also continue to be vocal and advocate for funding, resources, and equitable access to those social determinants of health. To leave you with this, Dr. Braveheart and Dr. Chase proposed the historical trauma and unresolved grief model to provide a pathway for healing. This path works to confront trauma, work to understand the trauma, including its history and impact, work on releasing the trauma and the pain of trauma by actively engaging in healing practices, and transcending the trauma through creating brighter futures for our Indigenous population. A good reminder is that if we have historical trauma in our history, in our present, and even maybe within our DNA, we also have historical resilience. So while they may have tried to bury us, they did not know that we were the seeds.